As a medical professional who has dedicated decades to cardiovascular care, I need to address something that weighs heavily on my heart. Too many seniors today feel invisible, as though society has quietly written them off. There's this unspoken sentiment that once you reach a certain age, your health concerns become less urgent, your pain less worthy of attention. It's as if the moment you qualify for retirement, the world decides you're no longer a priority. And frankly, that's not just wrong, it's dangerous. I've witnessed this dismissal firsthand in hospitals, in waiting rooms, and in the stories patients share with me. Seniors are made to feel like burdens on the healthcare system, like their continued survival is somehow inconvenient for budget spreadsheets and government programs. But here's what I believe with absolute conviction. Your life matters just as much today as it did 30 years ago. Your experience, your wisdom, and your right to quality healthcare don't diminish with age. They grow more valuable. And that's precisely why I'm creating this content. Because if the system won't prioritize your well-being, then I will make sure you have the knowledge to protect yourself. Heart attacks don't care about age discrimination, and neither should life-saving information. Nearly half of all cardiac arrest fatalities occur before the individual even reaches medical facilities. Why? Because people delay action. They downplay symptoms. They don't understand the straightforward, evidence-based measures that can maintain circulation long enough for professional assistance to arrive. The harsh reality is this: without proper knowledge, a cardiac event can become fatal within minutes. Every day, I encounter patients in critical condition who might have survived with just 1 or 2 different choices at home. Intense chest compression, abrupt respiratory difficulty, lightheadedness, perspiration, and by the time emergency teams arrive, the critical intervention window has closed. But there's encouraging news. There are research-validated techniques, straightforward actions you can execute immediately, even in complete solitude, that can significantly improve your survival probability. Not folklore, not unproven remedies, but genuine protocols that cardiac specialists recommend to their own families. In this comprehensive guide, I'll share 7 essential survival strategies every senior should master to endure a cardiac emergency when assistance isn't immediately available. These are the exact protocols I wish every critical care patient had understood before their medical crisis. And pay close attention to strategy number 3, because medical research demonstrates it can determine whether you face lasting cardiac damage or recover fully. Most individuals are completely unaware, but after reading this, you'll be empowered with that knowledge. All clinical references and peer-reviewed research I cite are documented at the end of this guide. Before we begin, I have a question for our community. What's your current age? Share your answer in the comments section. I make it a point to read and respond to each comment personally, treating it like a one-on-one consultation. Your input genuinely matters to me. Now, let's begin with strategy number 7, the very first action that could determine your survival. Strategy #7, contact emergency services without delay. The absolute first and most vital response when you recognize cardiac emergency symptoms is immediate action. Contact emergency medical services right away. Don't adopt a wait-and-see approach. Don't rationalize with thoughts like, perhaps it's merely acid reflux, or I'll monitor if it subsides. Each passing minute allows additional damage to accumulate in your cardiac tissue. Cardiovascular physicians explain this principle simply. Time equals muscle preservation. The extended duration that blood circulation remains obstructed, the greater number of cardiac cells perish, and the lower your chances of successful recovery. Clinical evidence supports this urgency. Data from the American Heart Association indicates that individuals who activate emergency services within the initial 5 to 10 minutes of symptom onset demonstrate survival rates elevated by as much as 50% compared to those who postpone action. Yet, tragically, numerous seniors minimize what they're experiencing. Research reveals nearly 1/3 of people over 60 delay seeking medical attention for more than 2 hours, frequently because they resist inconveniencing others or believe they can endure the discomfort. That reluctance proves fatal far too often. Consider this scenario. A 68-year-old retired teacher in Pennsylvania experienced unusual tightness in her chest one afternoon. She convinced herself it was probably digestive upset, consumed some antacid, and reclined to rest. She waited several hours, anticipating improvement. When her son arrived and immediately phoned emergency services, the cardiac damage was already extensive. Medical staff informed the family that prompt emergency contact might have preserved most of her heart function. This scenario repeats thousands of times annually, and it's entirely preventable. Therefore, if you're over 60 and experience intense chest tightness, sudden breathing difficulty, unexplained queasiness, or that distinctive cold perspiration, respond as though it's a cardiac event until medical professionals confirm otherwise. Reach for your phone and dial emergency services immediately. Even if it ultimately proves to be indigestion, you've sacrificed nothing. But if it is a heart attack, and statistically it often is, you've just completed the single most critical action to preserve your life. Recognizing urgency and making that call constitutes the first act of survival. While awaiting paramedic arrival, your subsequent actions can maintain circulation and secure additional critical minutes. That brings us to strategy number 6, a medically proven technique to sustain oxygen delivery when every second matters. Strategy #6, chew aspirin. If accessible and not contraindicated, after contacting emergency services, your next action could mean the difference between survival and tragedy. Chew an aspirin tablet. Don't swallow it whole. Chew it thoroughly. The reasoning? Aspirin isn't simply an analgesic. It's among the most effective anti-clotting medications available without prescription requirements. Cardiac emergencies occur when a clot obstructs circulation to the heart muscle. Aspirin functions by reducing blood viscosity and preventing the clot from expanding, maintaining some degree of flow until professional medical intervention arrives. The scientific evidence is unambiguous. A significant study published in the Lancet determined that aspirin administration during cardiac events reduced mortality risk by 23% among participants. However, there's a crucial detail. Speed is paramount. The more rapidly it enters your bloodstream, the sooner it begins its protective effect. Swallowing aspirin intact requires 10 to 12 minutes for gastric breakdown. Chewing it fragments the tablet immediately, enabling the active pharmaceutical component to absorb through oral and gastric tissues within mere minutes. In situations where seconds determine outcomes, those minutes can preserve cardiac tissue and save your life. One 70-year-old former accountant was alone at home when he felt that crushing chest sensation. He recalled his physician's guidance, located the aspirin in his medicine cabinet, and chewed it while simultaneously calling emergency services. Paramedics later credited that simple action with maintaining sufficient blood flow to prevent major cardiac damage. He was discharged from the hospital 2 weeks later, alive and maintaining his independence. Yet many seniors make critical errors here. They either lack aspirin in their residence or hesitate due to uncertainty about safety. If you have documented aspirin hypersensitivity, a hemorrhagic disorder, or explicit medical instructions against aspirin use, then omit this step. For all others, maintaining a container of non-coded aspirin in an easily accessible location represents one of the wisest emergency preparations possible. Physicians typically recommend one complete 325 milligrams tablet, thoroughly chewed at the initial indication of cardiac distress. Consider it this way. Chewing that single tablet is equivalent to deploying a rescue team to slow the catastrophe until full medical support arrives. It doesn't resolve the heart attack, but it can prevent the damage from accelerating beyond control. Swift aspirin action keeps survival odds favorable. But surviving a cardiac event alone extends beyond medication. It also involves how you position your body during those frightening minutes. That's where strategy number 5 becomes essential. Strategy #5, remove restrictive clothing and maintain upright posture. When cardiac distress strikes, every physical movement impacts the burden your heart must bear. One of the most straightforward yet frequently neglected survival measures is removing restrictive garments and sitting upright. Seniors often underestimate how quickly constricted circulation and improper positioning can worsen an already critical situation. Tight waistbands, belts, or collar buttons compress blood vessels and impede your body's ability to circulate oxygen-enriched blood when it's most desperately needed. Upright sitting relieves pressure on the diaphragm and respiratory system, facilitating easier breathing and reducing the workload on your already compromised heart. This isn't merely intuition, it's grounded in physiology. During a cardiac emergency, your heart struggles desperately to pump oxygen through narrowed or blocked vessels. Lying flat forces the heart to work significantly harder, particularly in seniors with compromised lung function or pre-existing respiratory conditions like COPD. By sitting upright, ideally at a slight recline with back support, you enhance airflow into the lungs, decrease intrathoracic pressure, and permit blood to circulate more efficiently. A clinical analysis in the European Heart Journal emphasized that upright patient positioning during cardiac distress helps minimize pulmonary congestion, essentially the fluid accumulation in lungs that creates the sensation of suffocation. In practical terms, your body position can literally determine whether you're gasping for air or maintaining sufficient composure to survive until professional assistance arrives. One 74-year-old woman in Arizona felt chest tightness while tending her garden. Rather than lying down in panic, she relocated to a patio chair, loosened her gardening belt and waistband, and sat upright while awaiting the ambulance. Her cardiologist subsequently informed her that this decision likely prevented syncope and collapse before paramedics could administer oxygen. That minor adjustment prevented her heart from failing under excessive strain. It's an intervention so elementary that many seniors disregard it, yet it's profoundly significant. If you experience those characteristic indicators, tightness, respiratory difficulty, or cold perspiration, sit upright. Relax your shoulders and release your chest and waist from any constriction. Think of it as providing your heart the space it requires to function. This adjustment secures precious stability. But to further enhance your survival prospects, you need to maintain blood flow to the brain and heart when circulation is compromised. That introduces strategy number 4, a potent physical technique seniors can employ during those desperate minutes before medical professionals arrive. Strategy #4, forceful coughing, if experiencing faintness. It seems unconventional, almost implausibly simple. But during a cardiac emergency, coughing, yes, deliberate coughing, can sometimes sustain you long enough for medical assistance to arrive. Medical professionals term this cough CPR. The mechanism is straightforward. When you cough deeply and forcefully, your thoracic muscles contract, your diaphragm compresses, and pressure accumulates within your chest cavity. That pressure propels blood from the heart toward the brain, maintaining consciousness when circulation is deteriorating. Let's establish clarity. Cough CPR isn't a substitute for professional medical treatment, and it doesn't cure a heart attack. However, it can secure valuable seconds if you feel faint, dizzy, or on the verge of losing consciousness before paramedics arrive. Research published in the Journal of the American College of Cardiology demonstrated that repeated forceful coughing during cardiac arrhythmias maintained patient consciousness and temporarily sustained blood pressure until emergency intervention could be administered. In certain cases, patients remained alert for several minutes, solely through coughing every 2 to 3 seconds. Envision this. A 69-year-old former electrician in Louisiana experienced a sudden wave of lightheadedness during what proved to be a severe heart attack. Alone in his garage, he remembered learning about cough CPR. He began coughing forcefully, repeatedly, and remained conscious until emergency responders arrived. Physicians later confirmed those coughs likely prevented him from collapsing and sustaining brain injury before they could stabilize his cardiac function. The science is elementary. Syncope during a heart attack results from an abrupt decrease in cerebral blood flow. By coughing vigorously, you generate artificial cardiac contractions, essentially compressing your chest muscles like a manual pump. It's imperfect and won't halt the attack, but it maintains oxygen delivery to the brain sufficiently long for professional intervention to take over. If you ever experience your vision tunneling, your head swimming, or your body weakening during chest discomfort, attempt this. Inhale deeply, then cough hard and forcefully, as though expelling something from your lungs. Repeat every 2 to 3 seconds until the lightheadedness subsides or paramedics arrive. Consider it as manually maintaining your cardiac rhythm when it's faltering. This unconventional yet powerful technique has preserved lives. But once you've stabilized yourself, you must also ensure oxygen enters your respiratory system effectively. That's where strategy number 3 becomes crucial. Another straightforward but life-preserving habit every senior should adopt. Before we continue, if this information is valuable to you, please tap the like button and subscribe with notifications enabled so you never miss essential health guidance like this. Strategy #3. Unlock entry points and keep communication device accessible. When a cardiac emergency occurs, every second holds immense value, not only for your physical condition, but for the emergency responders attempting to reach you. One of the most frequently overlooked survival measures is also among the most straightforward. Unlock your door and maintain your phone within immediate reach. It appears minor, but during a crisis, it can determine whether you're located in time or trapped behind a secured door while critical minutes elapse. Here's the significance. Paramedics receive training to forcibly enter if necessary, but every additional obstacle consumes time. And during a heart attack, time translates directly to cardiac muscle preservation. Studies demonstrate that for every 10-minute treatment delay, survival probabilities decline by nearly 10%. Imagine forfeiting those life-saving minutes simply because emergency personnel couldn't access you quickly enough. Unlocking your door in advance eliminates that risk. A 73-year-old widower in New Mexico learned this lesson tragically. He contacted emergency services after severe chest discomfort, but collapsed before he could unlock his entrance. Paramedics arrived promptly, but had to expend precious minutes forcing entry. By the time they reached him, excessive damage had occurred. Contrast this with an 80-year-old woman in Georgia who unlocked her door, secured her phone, and positioned herself in a chair near the entryway. Paramedics entered immediately, initiated treatment, and transported her to the hospital. She survived with minimal cardiac damage. The second component of this strategy is equally critical. Always maintain your phone nearby, especially if you reside alone. Too many seniors leave their phone in another room or connected to a charger beyond reach. During a heart attack, even traversing a few steps can trigger collapse. Having your phone adjacent ensures you can maintain contact with emergency dispatchers until assistance arrives. Some experts even suggest enabling speaker mode so you can follow instructions without holding the device to your ear. Consider it this way. Your phone serves as your lifeline, and your unlocked door represents the bridge that delivers help to you faster. Together, they eliminate barriers and reclaim time you cannot afford to sacrifice. Once the pathway for assistance is clear, the subsequent step involves maintaining your body sufficiently calm to survive until that help arrives. And that's where strategy number 2 proves decisive. Strategy #2, practice slow, controlled breathing. During a heart attack, panic becomes your most dangerous adversary. When fear dominates, your body activates its stress response, releasing a surge of hormones like adrenaline. This elevates your heart rate, increases blood pressure, and forces your struggling heart to work considerably harder. That's why one of the most elementary survival actions you can implement is also among the most potent. Practice slow, controlled breathing. Deep breathing accomplishes 2 vital functions. First, it enhances the oxygen quantity reaching your blood and brain, both desperately requiring fuel when circulation is compromised. Second, it signals your autonomic nervous system to stabilize, reducing the stress hormone surge that places additional strain on the heart. Research published in the Journal of Cardiopulmonary Rehabilitation and Prevention established that slow, controlled respiration, decreased heart rate, and improved oxygen delivery even in patients with advanced cardiovascular disease. It's not curative, but it provides your body a fighting opportunity while awaiting professional assistance. A 76-year-old retired educator from Wisconsin described surviving her cardiac emergency by concentrating exclusively on her breathing. As the crushing chest sensation intensified, she resisted the impulse to panic, She sat upright, closed her eyes, and began inhaling slowly through her nose, exhaling even more gradually through her mouth. When paramedics arrived, she was weakened, but still conscious. Her cardiologist later informed her that those steady breaths likely decreased her cardiac workload and maintained oxygen flow to her brain sufficiently long for treatment to commence. Here's the proper technique if you ever find yourself alone and endangered. Place one hand on your abdomen, not your chest. Inhale deeply through your nose, feeling your belly expand, then exhale gently through pursed lips, as though blowing through a drinking straw. Target approximately 6 to 8 breaths per minute, slow, controlled, and intentional. This diaphragmatic breathing pattern not only assists the heart, but also maintains mental focus when panic threatens to overwhelm. Think of each controlled breath as purchasing additional time. Time for oxygen to reach your brain, time for your heart to reduce its workload, and time for paramedics to arrive. And if there's one final habit that integrates all these survival strategies, it's the ultimate and most critical one. The action and number one that research demonstrates can double your survival probability. Strategy Hasson: remain calm and minimize physical movement. When a heart attack occurs, your initial impulse might be to move, to pace, or even attempt to walk off the discomfort. But that instinct can prove fatal. The primary survival principle is this: remain as calm and motionless as possible. Every step, every sudden movement forces your weakened heart to pump harder. And during a heart attack, your heart is already fighting for survival. By keeping your body still and composed, you reduce the strain, conserve oxygen, and optimize your chances of surviving until assistance arrives. Science explains this clearly. During a cardiac emergency, blood circulation through the coronary arteries is blocked or severely restricted. Movement demands additional oxygen from the heart muscle. But with its supply interrupted, that extra demand only magnifies damage. A clinical study in the European Heart Journal established that minimizing exertion during acute coronary episodes reduced complications and improved outcomes. In straightforward terms, seniors who remained calm and still survived at higher rates than those who moved around in panic. One 71-year-old farmer in Kansas learned this directly. While repairing machinery, he felt crushing chest pressure. His initial thought was to climb back up to retrieve his phone. Instead, he forced himself to remain where he was and called for help from that position. Paramedics later informed him that staying motionless prevented his heart from failing under additional stress. He survived with considerably less damage than physicians anticipated. Composure isn't solely physical, it's psychological. Panicking floods your system with adrenaline, elevating blood pressure and worsening the attack. By focusing on remaining still and practicing slow, deep respirations, you lower that hormonal surge and help stabilize your body. Tell yourself, I've contacted help. My sole responsibility now is to stay still and breathe. This mindset prevents impulsive decisions like attempting to walk to the door or retrieve something across the room, actions that can trigger collapse before help arrives. Think of your heart during a cardiac emergency like a fragile engine operating on minimal fuel. Every movement accelerates the engine faster and risks catastrophic failure. Stillness, composure, and conserving every unit of energy is the key to buying time. This is the final, most powerful habit. Do less, breathe more, and allow help to reach you. Together, these 7 strategies form a survival blueprint. And while you cannot predict when a cardiac emergency might strike, knowing precisely how to respond can determine whether you face tragedy or survival. And there you have it, 7 life-preserving strategies every senior should master to survive a heart attack when alone. From contacting emergency services immediately, to chewing aspirin, removing restrictive clothing, coughing when experiencing faintness, unlocking your door, practicing controlled breathing, and finally remaining completely calm and motionless. Each action secures precious minutes that can determine whether you live or die. Remember this, a cardiac emergency doesn't always offer a second opportunity. But if you respond swiftly, think clearly, and follow these protocols, you can survive and live to see tomorrow. The science is definitive. but it only functions if you're prepared to act. Now, I want to hear from you. Where are you located? And do you maintain aspirin or another emergency preparedness plan in your home? Share your response in the comments below. We read and reply to every comment because your story matters and your survival insights could assist someone else. Don't forget to like this content, share it with your loved ones, and subscribe for additional life-saving guidance. Stay safe, stay prepared, and remember, knowledge is power, especially after 60. If you have any questions or wish to share your personal experience, don't hesitate to leave a comment below. We're always listening. Thanks for your time.